This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Hey, everyone. Good evening. Thanks for joining on tonight on this Sunday evening to learn about programs. My name is Farah Hussein. I'm one of the chief residents for Emory PM&R. So me and Dayton are both the co-chief residents. Dayton's going to jump on in a little bit, and we're going to present an overview of our program. We're going to try to go through briefly of like rotation schedules, the sites that you'll be familiar with in our program, the didactic experiences, where our previous resident graduates go, some things that make Emory unique and life in Atlanta. We'll try to go through pretty quickly so that we can take as many questions as we can. And then feel free to throw some in the chat too. Okay. All right, real quick. So we are an advanced program, meaning that you're going to come in, if you match, you come in your PGY 2 year. So you do have to apply for preliminary or transitional year programs. So when you start here at Emory, you'll start your PGY 2 years. So you'll have already done a prelim year. And PGY 2 is primarily inpatient. We have a 2-month outpatient rotation in our PGY 2 year, which is nice. So it breaks it up a little bit. Most of the time you spend in our Emory Rehab Hospital and Shepherd Center on your inpatient rotations in brain injury, spinal cord injury, and medically complex. And then your outpatient rotation, your PGY 2 year, involves kind of like seeing a bunch of different stuff like sports med, spine procedures, general rehab, Botox, as well as some neuroimaging and seeing some prosthetic and orthotics. PGY 3 year is a mix of inpatient and outpatient. You'll go through our children's hospital, our Grady is our safety net hospital, one of the largest safety net hospitals in the country, and you'll go do consults there, EMG at Grady and the VA. So you really start your EMG your 3rd year. And then there's the opportunity for elective as well, so those who are thinking about fellowships can start getting use that elective time and really hone in on whatever specialty they're interested in and get those rec letters lined up. And then PGY 4 year is super nice because it's primarily all outpatient, except for 1 month of inpatient where you'll be senior the underclassmen. And so we do sports, there's sports rotations, pain rotations. We continue with general MSK and the VA as well. All right, an overview of Shepherd Center. So this is one of our primarily PGY 2 and 3 inpatient rotations. And this is a really great experience. We get free food here. And it's one of the constantly ranked in the top 10. It's a model system for brain injury and spinal cord injury. It has world-class facilities. So it's just really great. And there's our attendings down there. Like year by year, we all like vote on attendings who are teachers, teaching awards, and these attendings win these a lot. For the Shepherd Center, I'll talk about Emory Rehab in a little bit. This is great because you get really good learning experience with the attendings, and then our call is home call, but there's APPs, meaning like physician assistants and nurse practitioners who cover call at nighttime. So your second call at night, meaning that you rarely get woken up. all the nights of when you're on call there. So it's kind of a really great learning experience without many rigorous hours. Emory Rehab Hospital is our main rehab hospital on the Emory side. And it's also another unique experience. Those are attendings in the bottom. So one floor, it's about 23 patients per floor. There's 2 floors and there's 2 residents per floor. And so you split those patients up, and one floor is brain injury and stroke, and the other floor is kind of more medically complex. And we do see pretty complex patients. We see transplants, liver, lung transplants, cardiac patients, LVAD patients. We do see some spinal cord injury as well. And this one is where we have in-house call. And so you do get post-call days when you do your 24-hour call shifts here. At most, when you're on service, you'll have about 5 calls a month at most. But sometimes it goes like 4 a month or 3 a month, just depending on how many calls you've already done throughout the year. And then we do have consultants available in this hospital as well. And then the contrast between Emory Rehab Hospital versus Shepherd Center, you have a lot more autonomy here in Emory Rehab Hospital. So we do learn a lot in terms of how to feel confident in making our own decisions in this rotation. And this is Grady. This is where you get in your PGY3 rotation, you do your consult. So Grady is like the stroke center, the huge trauma center. So all it's a level 1 trauma. So you'll see the best of the best care here. And then you'll be able to go consult on the patients on trauma, spinal cord, all that kind of stuff in the ICU. Dr. Hendricks and Dr. Branch are attendings down there. And it's a really great experience with Dr. Hendricks. He does spine procedures outpatient. So when you're on these rotations, you can work with him and get some hands-on procedure learning too with him. And then Dr. Branch also does outpatient Botox procedures. So on these rotations, you'll be able to join her in clinic after your round and whatnot, and work on Botox procedures with her. So we also get experience in the Children's Hospital. There's Peds Rehab. One thing to note about our children's facility, has a really great robotics program for our Peds patients. One of the few robotics labs in the country. So it's great to have that experience and see those patients go through this program. And you get good. So one thing about our program, I think, is we really I went here because they said that residents get really good procedural experience, and I see that to be true on almost all the rotations. In Showa, you'll get good experience doing phenol, baclofen pump management, Botox injections. You'll even be able to do this kind of stuff in the OR because some of the patients need to be under anesthesia for whatever reason. So attendings are very, very they're very open to having residents doing these procedures, especially when they're under anesthesia. We're also at the VA. Our 3rd and 4th year here is primarily outpatient. We don't do any inpatient in the VA. You get lots of experience with peripheral joint injections, EMG, and then our prosthetic orthotic clinic is in here. You can also, you have the opportunity to practice ultrasound guidance as well. There's an ultrasound available for residents to use. As you can see, we have a lot of facilities when you go through Emory. So I'm just kind of going through all the different facilities right now. So the Emory Musculoskeletal Institute is a gorgeous building. It got built like my PGY 2 years, so about 2 years ago. And it's a state-of-the-art institute. And this is where you'll do most of your pain rotations and some outpatient spine clinics. So, and also our 4th year EMG rotation is here as well. So this is housing physiatry and orthopedic surgery for Emory, the Emory departments. And you'll be able to go into the procedure suites and do spine procedures with our attendings. And then the clinic spaces also have EMG labs as well. And that's where you'll do your EMGs for your patients. And then some of the attendings there are also in some of our rotations, more your 4th year, you'll be able to work with them and do ultrasound guided procedures as well. And one thing to point out is our residents do get a lot of exposure to fluoro guided procedures. You start your PGY 2 year on that outpatient rotation, and then it kind of increases more, your numbers increase as you get to PGY 4. And people graduate feeling pretty competent in doing general epidurals. So another facility is the Hawks Center, or Emory Sports Medicine Center, which is in the Hawks facility, which is where the Hawks and NBA basketball team also has their training rooms. So here you get to work with our sports medicine faculty, which some of them are listed below, big names in the field, and you'll be able to learn diagnostic ultrasound, and you train with leaders in the field of sports med and orthobiologics. Dr. Mautner is also the fellowship director for the sports medicine fellowship, and the residents all work one-on-one with him when you're a PGY 4. A couple other folks listed there, you'll get experience with them starting PGY 2 year and above. All right, so now we can go over some didactics and lectures. I want to see if Dayton's on here, my co-chief. All right, I'll just get started here. So for didactics, every Tuesday and Thursday, we have protected didactic time, where we all meet together as residents, either virtually. We try to do once a week is virtual, and once a week on Thursdays is in person, kind of just to get to see everyone as we're all spread out in different sites. And then we also do journal club, and we get the opportunity to be contributing editors as a PGY 2 year to the Rehab and Review Journal, which is the most widely read journal in the world. And then we also get to participate in orthobiologics and spine journal club once a quarter. So we do have, yeah, go ahead.
Tara, I'm here, by the way.
Hey, do you want to take over?
Yeah, we started early. What the heck?
I know.
Okay. So yeah, I'm Dayton. I'm the other chief resident here at Emory. I'm the academic chief resident. So I help with arranging kind of didactics is kind of my wheelhouse. So this going on to the didactics that we have here, we do competency modules in addition to the didactics that Farah already talked about, where essentially we have modules to help us with learning guides, and then also just quizzes at the end. And we also board review materials in a OneDrive, and we also have the ability to access previous lectures. And then the annual P&O Symposium and Sports Med Symposium is what we do to present. And yeah, sorry, that's most of all the presenting opportunities. And then we have MSK ultrasound block taught by residents and hands-on practice with sports med fellows, as you can see here. And here's some other workshops. We have EMG workshops. We have a cadaver anatomy lab, spine procedures, botulinum toxin workshops, and then intrathecal baclofen, wheelchair, and acupuncture. And then here's global health opportunities that we get with broadly through GME, but we also specifically have some projects through our department as well. Last year, the bottom picture, the resident went to Dominican Republic. I think actually the top picture is the year before, same place. But we also work with a place over in Cameroon. We sent a bunch of textbooks over there through our partnership with helping establish a rehab university over there. And then other perks, we can moonlight as a PGY4 either at our rehab hospital or other locations. You get $1,500 a year to present at conferences and 5 education days per year on top of the already 15 approved vacation days, and then $900 for a total of your 3 years for educational allowance for books or other opportunities, such as like software for producing papers or anything like that. And money for breakfast and dinner while you're on call.
5 minutes.
Those pictures were us as a couple conferences. So yeah, where our residents go, this is kind of a list of all the past 5 years. This past year, one ended up in a PEDS fellowship, 2 ended up in pain fellowship, 2 stayed here as faculty, just kind of 1 inpatient, outpatient, 1 outpatient, and then the other one went private practice, general PM&R. But we've also had, people go to pretty much every fellowship, as you can see, all these listed here.
I'll say for our class, so the current PGY4 class, Dayton and I are both applying sports medicine. We have 2 co-residents applying into the ACGME pain medicine fellowship, and then 2 planning to do general. And then Emory has pretty much all the fellowships available, which is another plus. We have sports med, pain med, TBI, SCI, and then there's in the future, they're going to try to start a cancer rehab program because we have some cancer rehab faculty here. So just if you're interested in fellowship, just going to a program that has that fellowship brings great opportunity to connect and get rec letters and get on projects and do experiences and rotations in those fields as well. Sorry, let me go back.
So on top of all the opportunities we have, we also have sports coverage, either through mass coverage, such as like the Peachtree Road Race, we help out with there. We also have sideline coverage, and then we do sports physicals. This year or last year we did Emory Freshman. This year I think we're doing that in Clark Atlanta University. So yeah, a lot of opportunities in the sports side. Also adaptive sports as well, if you're interested in that. So this is a picture from last year, our kind of annual welcome party from hosted by one of our physicians, Dr. Katz. He's kind of a wine connoisseur. So he has like wine from all over the world. You name it, he's got it. And so we get everybody who can go to this. Then we also have a wellness retreat where we try to get coverage for all the residents to go up. Last year we went up to LJ in North Georgia, had an Airbnb up there.
2 minutes.
And a couple holiday parties as well that each hospital we work at has a couple. Our social events, these are some pictures from previous years. Putt Shack, Rage Room, floating down the Chattahoochee River. And then the top right, we have a resident attending basketball game where we duke it out on the basketball court. This is the one of the holiday parties we were talking about. One is through the Shepherd Center, and the other one's through Emory Rehab Hospital.
There's just so much to do in Atlanta. Like the weather is great. We're from the Midwest. There's tons of concerts here, parks, music festivals, professional sports, all sorts of stuff. We do want to give some time for some questions, though. I know we're running short. So are there any
What about
questions?
30 seconds?
Okay, we can take a question then. All right, guys.
Yeah, thanks, everyone. We'll answer these questions in the chat here. Yeah, if you have any other questions, Farah, you want to just go to the last slide? Yeah, show us our social media and emails. You can reach out to us anytime.
Good luck to
so
everyone.
much.